So for the last couple of days, there's been, the annual 16 days of activism against gender-based violence, which ended on the 10th of December, and that's International Day of Human Rights. But the conversation doesn't end just because the 16 days have ended. No. The conversation continues, and that's why we're still having this conversation today. We want to talk about gender-based violence in the workplace. How many forms of it do we have in the workplace, and how does it present itself? And that's why we're joined by two people. Meng'anyi is a nurse, is a GBV advocate, and Women in Global Health Kenya chapter lead. She's here with Martin Kingoro, psychologist, Amani Counselling Center and Training Institute. Martin and Catherine, good morning.
Good morning.
How are you doing?
Great.
Karibuni sana to the hot seats of the Situation Room. How does it feel?
Not very hot.
Not hot, Cindy.
The start was good. Knowing that there's wealth discussed.
Very good. Now I'm here to welcome you with the day's proverb, courtesy of CT, who is, of course, like I said, he's out there on the golf course. He's teed off, I think.
Whole nine?
I do not know what he's doing. I don't get these things. Okay. The proverbs for this week have been from the Kingdom of Lesotho. You know where it is? Where is it, Catherine? Where is Lesotho?
Lesotho.
I can draw. People see when I draw. Kwa ile kona.
Kona gani?
Towards the... Okay. So you see I'm drawing?
Towards where?
There.
Somewhere. Iko kwa ile kona. Martin, yako iko kona gani?
Yangu iko huko kona ya chini huko.
Huko down. Huko down. In south.
Yeah. Yes.
Yeah. It's in South Africa. It's surrounded. Yeah. Everywhere it's just surrounded by South Africa. And yes, it's a kingdom. And they say that it's actually a kingdom in the skies because it's really high. Right? The entirety of Lesotho is highly elevated. Right? So when you're in Lesotho, you see South Africa from Angalia huko chini. Now, today's proverb, what the people think cannot be denied. What the people think cannot be denied. Catherine, what's your interpretation of this proverb?
I should say that there is need to respect people's thoughts because thoughts have power, and there is a lot when we open them up and interpret them in different ways to understand the deeper meaning. So every thought from an individual, there's a meaning behind it that can never be assumed.
Martin?
Okay, what people think cannot be denied. My thought would be like, since this thing is in the minds of people, probably it has a genesis. So it's coming from somewhere. So it means it exists. It exists somewhere. Yeah.
You can just rubbish it and say no. This is misinformation. No, this does not exist. It is. There's a genesis to what people are saying.
Yes.
Good interpretations. Okay, now let's get to understand the organizations first. Global Health Kenya chapter. What's that? Women in Global Health Kenya chapter. What's that, Catherine?
I'll say Women in Global Health, it's just a network, a movement of women who are out to have a conversation on how to strengthen gender equity in health. It's majorly founded in the US, but it has chapters all over the world. It has a total of almost 59 chapters, where Kenya is among the chapters that have been started. And we are keen at having discussions of gender equity in health and having a conversation on how do we end sexual harassment at the workplace. And then the matters of equal pay, because we really need to appreciate that 70% of health workers are women. So there's a need to have their voice from the decision-making tables, and also in terms of giving them a working condition that is very conducive for them to work and take care of the others.
Okay.
Yeah.
So are these chapters then just focusing on workforce in health?
Yeah, they're working on gender equity generally, but now very lean on looking at the health workforce, because when you talk about global health, But when you say health workforce, people think that they are only doctors, nurses, clinical officers. No, there are very many cadres who are working in the health sector, and they are not doctors or nurses or the rest. We even have lawyers, media people. We have one of us who's a media personnel, but very linked to health matters.
Yeah.
So those are the key people that we look at also.
So anybody who's working in the health facility?
Anybody working in the health space.
The health space.
It can be outside, inside.
Even cleaners, security.
Yeah, that's a health space.
Okay. Yes. I see. All right. Amani Counselling Center and Training Institute. Martin, what is it?
Amani Counselling Center and Training Institute is a non-profit making organization that's aimed at supporting people who are going through mental health issues. Basically, as it goes by the name, Training Institute and Counselling Center. Basically, we do the counseling. We support people through what we call clinical services, where we do a one-on-one in terms of counseling. We also do groups, and we also do trainings to institutions. We can tailor-make our services according to institutions. Then the training arm, we basically do the training. We train counselors at the certificate level and the diploma level. We also train social workers, both at certificate and diploma level. Yeah.
Okay. So then back to you, Catherine. When you talk about gender-based violence in the workplace, what are we talking about?
I know anybody will ask why Catherine is, let me take you back, passionate about talking about gender-based violence in general. Other than being a member of Women in Global Health, I also coordinate gender-based violence prevention and response in Migori County as the county coordinator under the health department, because I have seen people undergo and report violence, not only in the workplace, but even outside. So when we specifically talk about violence, we're talking about any act that is in terms of threats, physical violence, harassment, intimidation, or any other disruptive behavior that occurs at the workplace and can affect an individual to perform the task that's supposed to do. Then GBV does not look at who you are, so it's irrespective of your sex, your gender, your identities, and the rest. As long as it affects your human rights, it violates your human rights, that becomes gender-based violence. So it's just the same as the normal definition, but now this one confines to what happens at the workplaces.
But then it must be that this sort of violence or attack is because of your gender, right?
Yes.
It can't be just because one person of one gender does something to the person of the opposite gender, then we call that GBV directly, right? Because, for example, let's talk about threats. What's a threat in the workplace?
In the workplace, there's a context of power.
Right.
So most of the time you get people who are affected by gender-based violence at the workplace. The superior person will have more power towards the person who is below. So it's easy for you to intimidate or threat. For example, I'll give an example of someone who once called me working in some facility. It's a private facility I'll not mention today. And she was telling me that the boss was threatening her that if she doesn't agree to go on dates with her, she's going to lose her job. So to her, it was normal, because we've normalized GBV at the workplace. Like, it's a normal thing. The boss has said, a superior person has said this to me, so it's not something strong. But to her, I made her to realize that that was already gender-based violence at the workplace. But to her, she was just taking it like it's intimidation, which she doesn't realize that intimidation is part of it. So anywhere there is power at the workplace, and the person who is superior does anything to intimidate the person below, that becomes gender-based violence.
Okay. So that's a very clear example of where the boss is saying, go out on a date with me. And they maybe directly, expressly, or maybe indirectly implying that,
Yes.
come on, nataka kazi next week. Know how to play this game. That's direct. But are there others that are not about, intimidation and coercion for sexual favors? That would be something else. in the workplace?
There can be random texts that not everybody complies to these issues of I've gone to work, you want to be touchy-touchy. So you can take it to be normal, but the moment the power comes in, that can be mistaken to something different, or there are physical things that you can use, like I don't appreciate, you can greet me, I think the kawaida greeting, and you have to rub my arm. That's not consented, that's violence. Because unless we've consented and we have an agreement with you, that's different. But as long as you're taking advantage, it becomes violence. Other things can be very funny text. The people who send forward funny videos, like they're videos that are insinuating something else, like they're insinuating a moment of, I'll send you a very funny video that might insinuate that I might be liking you or something. But remember, the power difference comes in. Or maybe this person, you're taking advantage because they're very quiet. So that can also be violence. It might not be only that you're leading to sex. Violence can also be physical.
Even forwarding reels.
Exactly. That's very true. Or even hitting your worker with no reason. Physical violence comes in. Especially I'll give an example, maybe a cleaner working somewhere. And because you're superior, you're passing and kicking them for no good reason. That's already violence at the workplace. It needs to be considered.
Now, Martin,
Yes.
when you talk about the Amani Counselling Center, you're located along Mbagathi, right? And as someone has gone through now the problems at workplace and they need assistance, they then come to you. But people, Kenyans mostly are skeptical on accessing health services from a counselor due to the stereotypes that do exist when it comes to going to seek counseling, because of the myths that do exist when wazimu and such. So as we talk about mental health, ending GBV, how do we communicate to the victims such that they know seeking assistance, reporting to the people that handle this is okay, and that they will get the help that they need?
Yeah, basically at Amani or in the counseling circles, confidentiality is very key. The one thing that stands out. So whenever one comes to Amani Counseling Center, the number one thing is that we'll observe confidentiality. In Amani, we normally say we don't refer or use names. Me as a counselor, I may know your name, but no one else will know your name, because we normally use codes instead of names when it comes to something that can come in the public. When you come to our reception, our receptionist will ask you, what is your client number? And that's all they know, the client number. They know nothing more about you as a person. The only person who will know your name and maybe any other information is your counselor. And also as counselors, we make sure that we keep this information very confidential. In case of anything that we talk, it has to be behind closed doors in a room. Then when we come out of that room, that is the end of it. But basically, we also communicate where confidentiality ends. For example, if we are talking about a suicidal client, we also let them know that if it gets to a point of you risking your life or someone else's life is at risk, then we'll have to break confidentiality. So when it comes to that, we really observe confidentiality, and we also help our clients know that as they come to talk to us about what has happened to them, it will be very confidential. If we have to tell someone else, then they have to give us permission to do that. Yes.
And when we talk about counselling GBV cases at Amani Counselling, just in terms of numbers, if you have the stats, how does it look like, just specifically on GBV cases that come to your doorstep?
Basically, GBV cases are minimal. And I think Catherine alluded to it. One reason that would make GBV not be a thing that is coming forward time and again is because, number one, fear that I'll be intimidated. So like in the workplace, if a colleague, like a boss is coming and they're seeking favors, number one, the person may find a way of avoiding getting into the act, but at the end of the day, they also fear reporting because of fear of intimidation At times, it's also fear of stigma. That when people know that I went through this space or I was GBV, they will avoid me. Even friends, even your own friends may avoid you. They will not want to associate with you. So you find that that leads to very minimal cases of GBV coming forward. Yeah, but so the numbers are very minimal that come to Amani because those are some of the reasons that would make someone would fear I lose my job, number one. Number two, it's a stigma. The number three, fear of losing friends around me. Yeah, so that leads to numbers being very minimal. In fact, statistics say that whatever is reported is so much. So what we know is very little that come forward. And at times also, when one feels that they are secure with who the person they are telling, that's the only time they come forward. In fact, talk about one going to report in the police station. It might not be even taken serious. So people will always try to find a way to go around it and not come to talk about it. Yeah.
When people come for counseling and maybe just focusing on the workplace, and they're coming for counseling, what are they seeking?
Number one, they are seeking to see how do I manage whatever I'm going through. And as we talk about GBV, we say it can be physical, it can be psychological, it can be emotional. So number one, this person can come to Amani at times, not necessarily that I'm coming to talk about GBV, but I'm coming to talk about, and at times they are referred even by the same bosses because of they are not performing. And the lack of performing is as a result of what they are going through.
Yeah.
The molestation, physical molestation. So, and now which that adds up to psychological effect. So that also leads to non-performance at work. So at times the same boss is sending them to come, or it might not be the same boss. It might be colleagues who are putting her in that space. But the boss realizes that, I mean, you are a good worker. What is happening to you? What has changed? And so they refer them to Amani. And so when they come to Amani, at first they'll come to deal with the non-performance. But as a counselor, as we go around it, of course, I would want to get to the bottom line. What is happening? What changed? And what happened? And probably now the GBV case will come up. Yes.
Do you see many cases of men?
Very rare. Men are very rare. And in fact, looking at the GBV definition, at times it is said that violence against women. I mean, men we are at Onekani. And Eric, I mean,
is there GBV against men?
Yes, there is.
In the workplace?
In the workplace. But we don't talk about it.
Let's take a break. That's what I want to understand. Because we have to be very clear when we define this as GBV, and this as any other form of, toxic workplace and matters that have to be dealt with. Or even toxic workers who will come out and, just at this particular point, you're seeing everything as threat, as intimidation, as gender-based. Then how do you also deal with that and against that? Again, GBV in the workplace. So let's get into that distinction, right? So the relationship between boss and junior, you can say, yes. So boss is intimidating, is harassing junior. That can be harassment. But not all of that can be gender-based. How do we, if we're just dealing with just boss and junior, because that's the example that you gave us, are there instances where there can be boss, junior, harassment, yes, but it's not gender-based?
It needs to get a clear definition on what we'll mean by that harassment. But when you look at it deeper, and as I started doing the definition, there's something called sexual exploitation, abuse, and harassment. And remember, sexual harassment, which is majorly what happens in setups where people are working, that's GBV.
Okay.
But when you talk about sexual exploitation and it's more of humanitarian settings where the weaker person becomes the person receiving the aid, and then the superior person maybe becomes the aid workers or the humanitarian people. But when you talk about sexual harassment, it is clear, even if you look at the Sexual Offence Act, it covers sexual harassment as part of gender-based violence, and the law is there to cater for that. As long as it is clear, there are other intentions. I know people joke in offices at different levels. There's, I think, a recent case where there was a case of sexual harassment. Somebody was bringing it up as sexual harassment, and there was a question of where is the thin line between you want to get a spouse and you maybe both of them are not married, and GBV. But again, if it is left like that without clear guidelines, it will leave people undergoing violence and normalizing it as part of normal. Because there are people who don't take those jokes and things lightly. So sexual harassment is GBV at the workplace. As long as clearly I can prove that there is a power difference and you're using your power to put me down.
How about colleagues? Right? Mm-hmm. No one is above the other. You're actually same level. But like you said, there are two people, they're single, and one is trying to hit on the other.
Is that if for example, you're hitting at somebody the first time and they tell you, I don't like what you're doing, you still want to insist on it.
Playing hard to get. That's what happens in this world.
We usually say nowadays when a lady says no, it's a no. We are not saying playing hard to get.
And then later she'll say, but this guy just said no once and he moved on.
No.
Consent has to be there. When there's no consent, that's violence. Because adults, there's the context of, I'll give an example of GBV, and people will say, Catherine wants to be taken out for dinner. It's okay, you taking me out for dinner and you volunteered. You take me out for that dinner. That was our agreement. Buy me good wine. It's so good to take good wine. Nobody refuses to take good wine. You've bought me the food that you can call it high class. Even I've flown with Emirates. You've taken me to another place, Bahamas and the rest for celebration. When I reach there in the room, I tell you I'm not ready to be intimate with you. That was consent has been stopped. As long as we had agreed, but I said no at that specific time, that's the same thing when consent says.
I can see that. At that point when we are talking about now we are going into sex, fine. But if it's at that point where someone is just sending you a message, hey, can we have, you're all just walking by and you're like, hey, you look good today.
As long as somebody is comfortable.
How will I know that this person is not comfortable?
If I tell you I don't want, that tells you I'm not comfortable. And people are clear
I have already told you. Do I now come and ask you, can I tell you about what I think about how you look like? Before I tell you,
an example of a text.
Catherine, I like that jacket, Catherine.
That's a compliment. I'll say thank you.
I like how it makes you look.
I'll say, it's okay, that can be light on me. I say thank you. The next time you start telling me, maybe, you look hippies and I like the way you walk. Maybe I tell you I don't like such things.
Okay.
I'd even change my face. That tells you I am not subjecting to your talks. But if you continue to persist on it, that's wrong. That becomes violence because I've already put a clear line that I don't want. The first time you can make it like a joke. Anybody will pick it, that's a simple. Some people take jokes lightly. But somebody will tell you, me, I don't like the way, the people even don't like to be called the word dear in offices. Hi, dear. I don't like. There are different people reacting differently, and that's really allowed. And not only for ladies, also men.
Even for men.
Yes, GBV, it's a two-way. I know when people hear the word gender, most of the people will always think these people are talking about women. They're not talking about men. But gender, it's either a man or a woman, and currently we can look at the intersex also are there. So we can, when we talk about sex, so it's a man or a woman, we respect that. So even in the office, men undergo violence. But now we talk about violence against women and girls because the data is clear. Women and girls are highly vulnerable, one. And then two, the reported cases are many. So even request men, please report. We want this data.
Are there cases where you've heard that men report?
Yes, but very few. Even in hospitals.
And when they do, give an example.
I'll give an example of a young boy around 17, that's still a man, who underwent sexual violence, what most people call sodomy. So at first it was even hard for
in the workplace.
now on an
Okay.
outside world. I know the workplace. I've never had any man report that they've undergone violence at the workplace. Most of them will tell you, hata boss alikuwa nataka ni drive to the office, but it was okay. But then they don't know it's violence. They feel it's okay until it starts affecting them. But now for this boy, one thing I noted from this boy is why men don't report, because of what he clearly said. One, it's stigmatizing, because men, you've been brought up to be told kaa kama mwanaume, mwanaume ndio kusema, kaa ngumu, and the rest. So you grow up to the time umeenda workplace, you know, I am a man. So I am not even supposed to tell people, a lady alinikatia, it looks strange. But ideally, it's normal to report if it's violence. But to you, it will be strange when your boss tells you, hi, see, today I take you to Java. You, it's normal. Boss ananipeleka Java, favor. So when it keeps on going like that, it hurts you, because maybe it can even affect your family if you have a family, because there are very crazy hours. You're supposed to be with your family, but now you choose to be with the boss. But now how many men report this? Or how many men speak up?
So, Martin, is there, so now that men don't report these cases, is there a possibility that data we have, especially on GBV cases around men, is distorted because men naturally do not report? So statistics that you deal with does not really highlight issues, especially surrounding men.
Exactly. That's the reality on the ground. That the numbers that are reported are not exactly what we see. Like I was looking at some data that was reported by the National Police in 2021, and they were saying that about 8,149 cases were reported. Out of the cases reported, 92 were women, 8% were men. So those are the few men who come forward and say, and probably, as Catherine says, the young people who wako mtaani, and maybe imefanyika na wameambiwa awe twende useme. But at the workplace, no one will say anything. There's an incident. I was talking to a friend, and she told me that I was now talking about GBV, and she was like, okay, so you mean that's GBV? So she was telling me that there was this company where they went out, the HR alipeleka watu nje. Na wakati aliwapeleka watu nje kwa hotel, they booked into a nice hotel, and she put all the ladies on one side and all the gentlemen on one side. That was okay, maybe in her thinking. But she booked herself on the side of the men. And when they came out of that, from that trip, and they came back home, around 5 men said that they were lured into their HR's room. And so she had slept with the 5 guys. Of course, that's GBV. Because the fact that they came and said it, it means it was not their initiative.
Were they bragging about it or complaining?
Okay. It could be a very thin line between bragging and complaining for men. It could be a very thin line for them. So that's what she was sharing just to me.
So there was no consent.
Which means there was no consent. The fact that someone is coming to say it to someone else, and it's like, oh, so hata wewe.
And there is an aspect of power play that is going around, which then falls directly on GBV in workplaces.
In workplace. Yeah. And one thing Catherine was saying that comes out, I look at even this GBV thing is dependent on the recipient. Like the way we are sitting, Eric, with you, when there is a W here, for me, I'll see a W. Yep. You will see an M.
Yep.
So it depends on which side are you sitting. In which side are you looking at this GBV? Because even if I say like, wow, na umebeba, that's a word I'm saying, me mwanaume. It could be, I'm saying it, I'm complimenting you.
Yeah.
But the recipient, do they receive it that way? As long as they don't receive it as long as they picked an unwanted, unacceptable, I'll try that GBV.
So workplaces should have these policies, right, on how to address GBV and harassment in the workplace, even mechanisms on how to report, how to handle it, how to address it, right?
Yes.
Yeah. But we are clearly seeing that there's a mismatch here, that there's the entire understanding of this is violence against women. But it's violence across board. It's violence against colleagues.
Exactly.
Whatever level of violence, whether physical or not, right? Are there, to your best of your knowledge, are there any efforts that are being made to, number one, create more awareness on the definitions and understanding of one another in workplaces? Because, like you're saying, there are some offices where people really are open, they joke a lot, and there are colleagues who have gotten to that level where they take it as, it's a joke. A new colleague joins, and he comes or she comes and wonders,
what are you doing?
Yeah, but because all of us are used to this, we then subject the new one to the same. And that new one then is feeling different. Are there policies that address such kind of issues? And also policies that then encourage men to come out and speak about GBV?
Those are like I can say it depends on companies, or at times there could be policies, but there are policies on paper and on shelves that are not being put in practice, that are not being communicated to the people on the ground. And as we said, this thing has also something to do with power. If I am the boss and I know at one point whatever knife I'm putting in the hands of the other person will cut me, then it will more likely I will not want to put it across. I will not want to bring it out, because it's like I'm giving you the knife to use it against me. So at times policies are there, but they are not brought in the forefront, or they are not communicated to the employees, the people that is supposed to be communicated to. And that's why we are saying one of the things that should be done that we may combat GBV in the workplace is having these clear policies communicated or given to the employees, that we have clear policies given to the employees so that they may know. And even, in fact, also that we have clear policies on how to deal with it in case it has happened in an institution. What are the steps to be taken so that we combat GBV at the end of the day?
How about you, Catherine?
I think I should add that we have a lot of acts, a lot of policies in place. A small study that we did as Women in Global Health, just for women leaders at different levels, what shocked us is most people do not even know the policies that protect them, or even acts of the laws that may protect them from violence. A quick one, I usually ask people, have they ever read the Constitution of Kenya to understand what it talks about workplace? Most people will tell you tulisomewa, but they don't know the specific place where you'd say, because if you look at the Constitution of Kenya, there's a place, section 41(2), it says that every worker has the right to reasonable working conditions. So reasonable working conditions talks about also violence at the workplace. When if it's GBV or any other violence at the workplace, it protects one. If you look at the Employment Act of 2007, it is very clear and can be used because it states that it prohibits employers from harassing or discriminating against employees or prospective employees. So it clearly tells you you're not supposed to be discriminated at the workplace, but how many people know it's there and they can stand to use it when they undergo that. Sexual Offence Act 2006, very clear. It has a clause on talking about sexual harassment. And it's clear talking about Article 23 talks of situations, conduct, and grounds that would constitute sexual harassment. So it clearly tells you when sexual harassment will come in, how you can report it, and even the charges and the fines if you undergo sexual harassment. Another one that I can end with is the Sexual Employment, the Employment Act. It's Article 4, Sub-Article 1. It talks about prohibits forced labor. So if somebody wants to forces you into forced labor because of other favors, you can report. But now, how many people know that these exist? How many people are using this to defend themselves? Very few people. So you've normalized violence so much, it has become a norm. So even if you undergo violence at the workplace, you're like, I'll be sacked if I talked about this. I will spoil the companies. The hospital will be looked upon. So even healthcare workers, a lot of healthcare workers undergo violence at the workplace. But now they don't know to limit. It is either from patients or even from the workers they're working with. But now, how do you understand what will protect you? And then lastly, I should say, we need to have a grievance reporting mechanism. that is very clear and will tell you your confidentiality will be kept safe, and then you are protected in case you report. Because I know the challenge comes in, Catherine will not want to report she's undergone violence because she knows, too, everybody will be pointing fingers at Catherine all through. And then losing the job, it's very easy. I might not lose the job, but I'll go into mental breakdown because going to a work and then somebody says, huyu ndiye anastakingi wakubwa. See, that's a very intimidating statement. And we even saw an example what happened in Kericho T. We all saw the stories. You see, the kind of intimidation you go through will make you not to speak up. So it's just time to tell people, let us understand the policies, the laws that are there that protect you at the workplace and use them well. Then from there, we put the government into task to put up clear grievance reporting mechanism. Because if people are to open up, there's a time, I'll say quickly, I posted in my WhatsApp status. I usually love posting issues on GBV. And I brought up the Sexual Offense Act and harassment. And a very senior person in one county, very senior, just came into my inbox and told me, Catherine, it's hard for me to speak up. For me, it's even worse. What about the people who work below me? And it's a lady. So I was asking, if this person at the senior most level would say this, undergoing violence and cannot speak up, what is happening to the people who are working below her? Meaning now they are completely tarnished and they don't have strength. So I just told her there is a law and you can use. But now the issue she told me is there is no grievance reporting mechanism that it's clear that can protect me when I report.
Yeah. Because you want to report, but then you don't know the repercussions of it.
Yes.
Should there be confidentiality, really?
Yeah.
Why?
Because when you talk about GBV, it's a very sensitive topic, and most people would not, like even the women who have reported right now, it's a tip of the iceberg. As much as we say women and girls, trust me, women right now, some of them report after they've undergone so much trauma and they're coming up to see it. So it's also a tip of the iceberg on the cases of GBV you're seeing among women. But now when you open up, it will be more. Then, why confidentiality? It's because I report I'm talking about you. And I'm not ready for people to know I am talking about Catherine, who is the perpetrator.
Do you want the issue to be dealt with or not? Because if you do, then I definitely am going to be called.
You have to prepare me.
Yeah. If I'm going to be called to come and respond to this issue, then there's no confidentiality. It's already gone.
It's confidentiality can be two-way.
I could go back and start saying, unajua nimeitwa kwa nini? Catherine anasema tijana vile tulipita hapa hivi. She felt that I was harassing her. And we start having that conversation.
That's why we have to have a grievance reporting mechanism. Because if it's strictly, it's put you under oath. Like it's, example, under oath, even if you start a case, you should not talk about it. This should be protected. So people misreporting because of exactly of what you've said.
But I want people to know so that they know, they can also judge. I want the public opinion to know, was that harassment or not? Maybe Catherine and the boss have engineered a case against me. And now because of this confidentiality, I can't talk about it. I'll just be fired. And it'll not be clear why I got fired. I don't feel that I committed the offense.
Can I echo something?
Yeah.
When you put up a grievance reporting mechanism, you don't look at one way. It's not about two people. It becomes an independent person who comes in to listen. Not even one person. Independent team that will listen to just judge between the two what comes out. Then if you want to also pick it up, you can go to the police also. It can be reported and the police do their own investigations.
Okay.
Yes.
Thank you very much both for joining us. It's been a good conversation. Catherine Meng'anyi, nurse, GBV advocate and Women in Global Health Kenya chapter lead, and Martin Kingoro, psychologist, Amani Counselling Center and Training Institute.
This is the Situation Room, the only way to start your